Use of aripiprazole. Aripiprazole is a medication used to treat several mental health conditions, including schizophrenia, a severe mental disorder that affects how a person thinks, feels, and behaves. Aripiprazole can help alleviate symptoms such as hallucinations, delusions, disordered thinking, and lack of motivation. Bipolar disorder, manic depression, and mental illness characterized by episodes of mania and depression. Aripiprazole can help to stabilize mood swings and prevent future episodes of mania or depression. Depression, a common and serious medical illness that can cause persistent feelings of sadness and loss of interest. Aripiprazole can be used in combination with other antidepressants to treat depression. Irritability associated with autistic disorder in children and adolescents aged 6 to 17 years. Aripiprazole can help to reduce symptoms of irritability, such as aggression, self-injury, temper tantrums, and quickly changing moods, in children and adolescents with autism. Dosage of aripiprazole. Take aripiprazole as prescribed. Mechanism of action of aripiprazole. Aripiprazole works by restoring the balance of certain natural substances, neurotransmitters, in the brain. Aripiprazole is a partial agonist at dopamine D2 and serotonin 5-HT1A receptors and an antagonist at serotonin 5-HT2A receptors. In individuals with schizophrenia, aripiprazole can help to regulate the activity of the neurotransmitter dopamine in the brain. By partially activating dopamine receptors, aripiprazole can reduce the excessive release of dopamine that leads to symptoms such as hallucinations, delusions, and disordered thinking. In individuals with bipolar disorder, aripiprazole can help to regulate the activity of both dopamine and serotonin, two neurotransmitters that play a role in mood regulation. By partially activating these receptors, aripiprazole can help to stabilize mood swings and prevent future episodes of mania or depression. In individuals with depression, the mechanism of action of aripiprazole is not fully understood. However, it is believed to involve a combination of partial activation of dopamine and serotonin receptors, as well as blocking of serotonin receptors. This can help to regulate the activity of these neurotransmitters and improve symptoms of depression. It's important to note that the mechanism of action of aripiprazole in treating irritability associated with autistic disorder is not well understood. However, it is thought to involve regulation of neurotransmitter activity, particularly dopamine. Side effects of aripiprazole. Like all medications, aripiprazole can cause side effects. Some common side effects include nausea, vomiting, constipation, headache, drowsiness, insomnia, agitation, tremors, dizziness. Less common but more serious side effects can include It's important to inform your healthcare provider if you experience any side effects while taking aripiprazole. If you experience serious side effects, such as difficulty breathing or swelling of the face, lips, tongue, or throat, seek immediate medical attention. It's also important to keep in mind that everyone reacts differently to medications and not everyone will experience side effects. Important advice for taking aripiprazole. Here are some important tips for taking aripiprazole. Follow your healthcare provider's instructions. It is important to follow your healthcare provider's instructions for taking aripiprazole, including the correct dose and frequency of administration. Do not change your dose or stop taking the medication without first talking to your healthcare provider. Take aripiprazole at the same time each day. Taking aripiprazole at the same time each day can help to maintain a consistent level of the medication in your body and reduce the risk of missed doses. Drink plenty of fluids. Aripiprazole can cause constipation. Drinking plenty of fluids and eating fiber-rich foods can help to prevent constipation. Monitor for changes in mood or behavior. Aripiprazole can cause changes in mood or behavior, including agitation, restlessness, or suicidal thoughts. Do not drink alcohol. Drinking alcohol can increase the risk of side effects and interact with aripiprazole. Store aripiprazole in a safe place. Aripiprazole should be stored in a safe place, out of reach of children and pets. It's important to follow these tips and consult with your healthcare provider if you have any questions or concerns about taking aripiprazole. Your healthcare provider can provide you with more personalized advice based on your individual needs and medical history.